The governor's off-island signature of Calvo Select Care insurance contracts could be illegal for two reasons: lack of funding and lack of authority. Attorney Randy Cunliffe says the chief drops his headdress when the wheels leave the runway.
Clearly, it's intended that when the governor's not on Guam, he doesn't have any power. So he can't sign a contract on behalf of the governor of Guam, and he's not the governor.
That's what the Organic Act states. But the transfer of authority argument is just the tip of this legal iceberg. It's been widely reported that GovGuam does not have the money to pay for Select Care's multi-million-dollar health insurance agreement for fiscal year 2011. Speaker Judy Wanpat called attention to the matter last week before Camacho endorsed the deal.
But because we have not seen any numbers that there would be a need for at least $20 million.
Today, Budget Chairman Ben Pangalinan's staff is crunching numbers to determine how much the Select Care agreement will actually cost GovGuam. Now that the Bureau of Budget and Management Review is purportedly scrambling to back Camacho's new health care contract with enough revenue to cover the first few months, some in the legal community are saying not so fast.
You know, how can a good leader ignore the needs of the people with regard to, expenditures like that?
Legal. I don't believe that BBMR can certify part of the contract. I mean, unless they modified the contract to be a 6-month contract and therefore they certified the funds are available till April, you have to certify the contract, not a part of it. You can't certify just a portion of the contract. And so that certification's, in my opinion, also invalid.
The funding gap is causing Attorney General candidate Gary Gumatautau to bare his legal teeth.
Is it a matter of certifying based on appropriation or certifying based on cash available? Here, there's no question. It's not even a matter of whether the cash is available. It's not appropriated. If it's not appropriated, it's not legal. What are they doing certifying? If they certify that thing and I become the AG, I guarantee you there's going to be some criminal charges brought before a grand jury panel. And let's see what the grand jury says about whether it's legal or not. But I think we're going to be in a tizzy over this because the people are going to end up either with no health care while we litigate it, or we're just going to ignore it and they're going to get slapped with 300,000 or 300% increase. It's just horrendous. I just don't see how we're going to live with that.